So with disc herniation, again, it could be an acute traumatic incident or it could be insidious. And it's going to be some type of loading or compression or rotation. Basically what's happening, like I say, is there's weakening of the endus fibrosus and the nucleus pulposus herniates out. And since we're putting pressure on the nerve root, what kind of symptoms would they have which is different than a facet syndrome? I don't know, if, a lot of times you call it facet, you call it facet syndrome in the low back, but if you have a facet injury in the neck, where's the pain going to be? It's going to be pretty much one spot, the same side, consistently with certain motions. But if you're irritating the nerve, where's the pain going to be? Yeah, it's going to go down the arm. Okay, so if you do, tests like this, there's pain going down the arm, that's going to be an indication that it's more like a nerve-involved injury. So usually with disc herniation, you can have pain down one side, radiating down the arm. Okay, so that's, like I said, when you want to find out distinguishing characteristics of these different conditions. Okay, facet problem is going to be usually one side of the neck, just in the neck with certain movements. Disc herniations are most of the time going to be radiating down the arm. So it's going to be consistently the same. If it's going, right, if it's going to be C6, the way you remember C6 dermatome like this. Right? So if they're saying they're getting symptoms right into here, it's going to be reproducible, consistent. It's not going to change. Does that mean for sure it's never going to change? No, but most of the time, yeah, it's going to stay the same. And then basically, we're going to be doing different special tests for that. Is anything that's going to be involving compression or distraction. Distraction should relieve it if it's a disc herniation. It may make it worse if it's a ligament tear. But so now we get into contractile tissue injuries. So basically, you're going to have muscle strains. Again, they can occur together. You can have a sprain-strain combination injury, where you're tearing ligaments and then also affecting muscles. Basically, it's a situation where you've overstretched the muscles beyond its strength, and so you're going to tear the tissues. So basically, it's going to be microscopic tearing of the muscle tissue. All right, and then what did we say before about as far as differentiating between inert tissue and contractile tissue? What types of situations are going to produce pain in a contractile tissue injury? Is it going to be passive range of motion or something like active or active resistance? So something where you're causing the muscle to contract. So they're going to have pain with movement of the neck. And it's usually going to be, if a specific muscle is going to be stretched or torn, they're going to have pain in that, in that spot consistently. And then the mechanism of injury, if it's an acute muscle strain, is going to be some forced mechanism of injury in a certain direction. Now, obviously, if you move the head this way suddenly, you're going to tear this muscle. This way it's going to tear that. Whichever motion is going to overstretch a muscle. And then they're going to have, they may be the kind of person that comes in like this. Can you turn your head? Yeah. They're not going to want to move their muscles that much. And then you're going to do the special test. Again, it's going to be, you don't see passive range of motion on there. It's going to be either active or active resisted, or if you remember, Donahue's is a combination of passive range of motion and resistance. I didn't change these pictures yet. These are actually pictures of the lumbar spine. We're still going to talk about the same type of thing. So for the nerve roots, we're talking about the brachial plexus. So you can have different ways that the nerve roots can get irritated. You have the intervertebral foramen, which is where the nerve root comes out. So how can that get affected there. Like I said before, nerves are stretched and torn, or they're compressed, or the opening they go through gets narrow. So you can have compression at the IVF by a disc, or by pieces of bone, or DJD that's narrowing the opening. So either that opening is going to be constricted, or you can have some type of stretching or tractioning force. So basically some type of an injury that the shoulder gets stretched down and the head gets out like this. So you're overstretching the muscle, the nerve. So if you have a mild stretch where you're not actually completely tearing or severing anything, you can typically recover from that. Okay, a lot of times if you've heard of people playing sports or anything, it's usually called like a stinger, where let's say if somebody goes and they're tackling and their head goes like that, they'll get it like a zing down the arm, but they didn't tear the nerve. So typically you can recover from that. But you can also have you can have partial tearing, or you can have a complete avulsion. Like I had a patient that years ago, when seatbelts weren't in like they are now, he was riding in the back seat of a VW Beetle, right? Car rolled over, and somehow he had his head stretched like that, so basically he tore the nerves here in the brachial plexus, so his arm pretty much doesn't work. So you can have any extreme from one level where you just kind of tugging on the nerve where you're getting the symptoms down the arm, versus partial tearing where you may have some motor or sensory losses, versus complete tearing or avulsion where you have where it's not functioning. So again, it's anything that's going to narrow that opening. So minor movements or subluxations of the vertebra can constrict that opening. Traumatic injuries where the facet's right there, so if you have either DJD of the facet, where that bone is growing into the space, or DJD of the vertebral body, anything that's going to narrow that opening. And then they're going to get shooting pain down the arm. So again, something that's going to irritate that nerve root, that's going to compress it, they're going to have radiating pain. It's like when we're talking about disc herniations, right? So not only can the disc cause nerve root irritation, you can also have bony overgrowth that's going to narrow it. So the symptoms are going to be the same. You're going to have pain that's down the arm that's affected by neck movement. Okay? They're going to have pain at night, they're going to have trigger points in the muscles. You know what these words mean, right? Hypo meaning decreased. Reflexia, so they have decreased reflexes. Aesthesia as in sensation, so they can have decreased sensation. And then again, those same special tests that we kind of mentioned, basically anything that's going to narrow that disc, that opening where the nerve goes through. And then here's the way another